In recent years, creative music therapy really has emerged as a very promising new therapy to improve neurodevelopment of preterm infants. And in the protocol we provide here, we really describe how we can use music and singing to empower the infants and their parents. Creative music therapy is a relatively low cost and most likely low risk intervention, which has great potential for improvement of outcomes of preterm infants and also of outcomes of parents, parent-to-parent interaction, also child-to-parent interaction. But we definitely have to prove that it's really working.
Creative music therapy can be provided to other patient groups as well, for example, hospitalized infants. It can be extended to at-risk pregnant women and follow-up music therapy after discharge. This method may function as a neuroregenerative and neuroprotective early intervention. We may speculate that the enriched musical socio-emotional experience may promote brain development. The individual performing CMT should be a specially trained music therapist who is familiar with the assessment of the needs of the preterm infants and the parents, and with all music therapy methods in neonatal care. It is important to be responsive to the needs of the macrosystem up to the microsystem level, to the intensive care unit environment.